Hi, this is Dr. Lara. Today we're here to talk about diabetes and how it affects your mouth. There are over 30 million people in the United States of America suffering from diabetes. That's almost 1 in 10 people. And another 80 plus million are pre-diabetic, meaning they are at a very high risk for developing diabetes. Most people know that diabetes affects your eyes, your nerves, your kidneys, your heart, but a lot of people didn't realize that it can also affect your mouth. So we're going to discuss the various ways that diabetes affects the health of your mouth. Some patients don't even know that they have diabetes, and these symptoms are showing up in their mouth, and that can help their doctor find that they have diabetes. So the most common correlation between diabetes and oral health that we see in dentistry is periodontal disease or gum disease. Periodontal disease is a disease that attacks the foundation of the teeth, the gums and the bone that hold the teeth in. As periodontal disease progresses, you lose that attachment that holds your teeth in place, and teeth can become loose and they can fall out. Periodontal disease is sometimes very difficult to treat, and we have found that in diabetic patients it's even more difficult to treat because there is kind of a vicious cycle that periodontal disease actually makes diabetes worse. It has an effect on the blood sugar. When the blood sugar is uncontrolled, that makes periodontal disease worse. And so these two diseases just compound on each other, and it's very difficult to get them under control. Another issue that we see in the mouth with diabetes is cavities. Just like diabetes increases the risk for periodontal disease, it also increases the risk for various other infections in the mouth. Cavities are an infectious disease. They are caused by a bacteria that works its way into the teeth. So because the body is naturally more at risk for infections when you have diabetes, then they are more at risk for developing cavities. Another problem that we see very commonly in diabetes is changes in the sensation of your taste. Some people say that they can't taste things as well, and so they want to have more flavor, more spicy foods. The risk for this is that some people will add more sugar to their food to make it more flavorful in order to taste it better, and that increases the risk for cavities as well. A big problem with diabetes is having a dry mouth. Diabetes does affect the production of saliva by your salivary glands, so naturally the body is going to be producing less when you are diabetic and have poorly controlled blood sugar. Also, some of the medications prescribed for diabetes cause dry mouth as a side effect. So this is another compounded effect of diabetes. When the mouth is dry, the body's not able to fight bacteria because saliva is our body's natural defense against things like cavities and gum disease. So when you have dry mouth on top of diabetes, the risk is even higher. There are several other types of problems that people will experience in their mouths when they have diabetes that's poorly controlled. Because of the risk for infections, there is a high risk for developing a candidal or fungal infection called thrush. This risk is even higher on patients who wear a partial or a denture, something removable that they take out of their mouth, because that's extra surface area for the fungus to collect on. It can lead to a thrush infection. Diabetes affects the body's ability to heal, and so if you have wounds or ulcers or sores in your mouth, for instance, if you have a sore that started when you scratched your gums with a tortilla chip that had a sharp edge, that will take longer to heal in a patient with diabetes. Also, when you have a surgical procedure in your mouth that's necessary for dental work, the healing period from that procedure can be longer and it can be less predictable in a patient with diabetes. Another complication we see in diabetes in the mouth is something called burning mouth syndrome or tongue pain. There is not a great explanation for this, just that it is correlated with diabetes. So what do you need to do to take care of your mouth if you have diabetes? There are several recommendations that we have for you if you are diabetic or pre-diabetic. You want to make sure you always keep up with consistent, frequent dental visits. Because of the increased risk for gum disease and cavities, you want to make sure you're seeing your dentist regularly, and you may need to see your dentist more frequently than someone who does not have diabetes. For instance, many of our patients that are diabetic will have their teeth professionally cleaned by the dental hygienist every 3 months as opposed to every 6 months. You want to make sure you complete any necessary dental work. If you have a cavity or if you have some gum disease, make sure that you have the treatment done for that, because in a diabetic patient, those infections are going to progress more rapidly in the presence of diabetes than they would without. You also want to take steps to manage your dry mouth. I won't go over those in detail here on the video, but if you read the blog, there is a list of steps you can take if your mouth is dry as a complication of diabetes that will help you to improve the state of your mouth. You definitely want to be considerate of issues that could happen with oral surgery. Your oral surgeon or your dentist will need to communicate with your doctor, so you want to cooperate with that to make sure that your blood sugar is at a healthy level for you to have surgery completed. Definitely do not smoke. Smoking is bad for many reasons, for oral cancer, for gum disease. It is another compounding factor of diabetes. When patients who have diabetes smoke, the risks of all the issues that we discussed earlier are exponentially higher. And then the last recommendation is, if you do wear a removable appliance, a denture or a partial, make sure that it's removed every single night and that it is properly cleaned. If you're not sure how to clean your denture or your partial properly, come on in and let Dr. Agarwal take a look at it. She can give you the necessary tools you need to clean it and also recommend the best products for cleaning it, so that you reduce that risk of developing any infections in your mouth around that partial or appliance. If you have more questions about how diabetes is affecting your specific oral health, please call and come in and see us so that we can give you lots of customized recommendations for your specific case. There's plenty more information in the blog, so if you want more, read that. And thanks for watching our video. Have a great day.